Studies show that healthcare costs are expected to increase over time. The key element to planning for medical events in retirement is Medicare, and there are some key dates to keep track of. Medicare and Medicaid are government-sponsored plans designed to help Americans gain access to healthcare coverage. Both started in 1965, and there are some key differences between the two.
Medicare, quite simply, is just health insurance as you get older, for people 65 and older. Medicare, that's what, just in a generic sense, and it's a way to minimize your health expenses by shifting the burden to someone else. In this case, the government, and then also your supplemental policies. Most everyone I've ever talked to is confused when we talk about Medicare and Medicaid. Medicaid is a state, offered by the state, a state program. Medicare is federal. Best way to talk about it. Medicaid is for people that really can't pay for anything on their own, and Medicare is for people that can pay for some stuff on their own.
Medicare is a crucial part of any retirement plan, so it's important to know when you become eligible and how to enroll.
You can start the process 3 months before the month of your 65th birthday, depending on what you want. Well, first of all, let's say you retired at the age of 63 and you started collecting Social Security right out of the gate. You will automatically be enrolled in your Part A and B. You don't have to do anything. But like somebody like myself who is not collecting Social Security yet, I had to go to ssa.gov and sign up for my Medicare Part A and B only together. Now, what's kind of cool about that is I got my number inside probably 5 or 6 days. It was almost immediate, and I had my card in 8 days. Now, if you are going to collect Medicare and your Social Security, if you can do everything all in one shot, you want to get a head start on that, okay? Because you're looking at probably at least a month. So that's the thing, is you just want to make sure you have plenty of time. I always tell folks, that 3 months before the month of your birthday, go and do what you got to do, and I tell them exactly what they have to do.
You may have great healthcare coverage through your current employer, or are waiting until later in life to retire. If that's you, there are some important rules to know about surrounding late enrollment, among other things.
Medicare supplements are basically private insurance. So therefore, they have to accept you. They have to accept you because it's initial enrollment period. However, they can charge you a lot more money. So if you're 63 going to a Medicare supplement off of SSD, instead of paying $100 to $120, you're going to be paying $400 to $500 for that supplement. And then when you hit 65, you re-enroll and you go back down to $100 to $125. So, and the other thing is that, I haven't experienced this yet, but I've found, when a friend of mine who had cancer, he had stage 4 lung cancer, and I said, we're going to put you into a supplement. The first thing we're going to do. And I looked at it and went, whoa, that's not happened. And then I looked at his medication and said, whoa, that's not happening. So guess where he ended up? A Medicare Advantage plan. I look at fixed cost versus presumed cost. If I can get a lower premium on something, I know I'm not paying that extra $500 a month. So therefore, I'm assuming the risk of something going wrong. But what are the odds of something going wrong? It does happen in life. It does happen. But I look at the odds of paying that $500 a month, which is 100%. So therefore, I always look at fixed versus presumed, and I'll always lean towards the fixed savings.
Timing is a key part of planning for retirement, and planning for health events is crucial as you're nearing retirement. That's why we take a holistic approach to retirement planning, from savings to health care and even long-term care. Coach Pete and the team at Capital Financial can help you navigate the financial world and get you to where you want to be in retirement. Take advantage of the no-cost, no-obligation financial review to understand the ins and outs of your retirement plan. A customized plan based on your wants and needs. Contact us today. Also, be sure to like this video and subscribe to this channel for more retirement help.